afternoon. This is a Bahamas Health News Update, Maternal and Child Health Edition. My name is Shawneka Brown, but you can call me Student Nurse Brown. Today we are going to discuss jaundice. We are going to dive into the world of jaundice, exploring the implications of jaundice, the protocols of jaundice, as well as the management of jaundice. We are going to take a further look at jaundice in not only pregnant mothers, but also in infants. So stick around, you don't want to miss it. And we're back. So now we're going to hear from Brittney Rolle, who is going to explain to us exactly what is jaundice. Why is jaundice so important to us, and why must we watch out for it? So take it away, Brittney.
Thank you, Shawneka, for that wonderful introduction. Jaundice, also known as icterus, is a condition in which the skin, the sclera, which is the whitening of the eye, and mucous membrane turns yellow because of hyperbilirubinemia, which is a condition where there is too much bilirubin inside of the blood. Although jaundice can occur in adults, including pregnant women, it is most common in infants. Infant jaundice occurs in 3 out of 5 babies born before the 38 weeks gestation period, or preterm babies, and some breastfed babies. During pregnancy, the mother's liver removes the excess bilirubin for the baby. However, after birth, the baby's liver is responsible for moving the excess bilirubin. In this case, some babies' liver may not be fully developed yet to remove the excess bilirubin. In this event, jaundice occurs. Jaundice can be placed into 3 categories, which are prehepatic, intrahepatic, and posthepatic jaundice. We will now have Dorin Woods with the implications.
Thank you, Brittney. This is Dorin Woods reporting on the implications of maternal and infant jaundice. Maternal jaundice may occur in the early stages of pregnancy, but most likely in the 2nd and 3rd trimester. If a mother develops jaundice, she may experience itching of the palms and soles of the feet, abdominal pain, yellowing of the skin and eyes, and whitening of the stool. Maternal jaundice may also cause fetal distress, respiratory problems of the infant, premature birth, and meconium in the amniotic fluid. In relation to infants, premature infants are more likely to develop jaundice. Studies have shown that jaundice in newborns may be linked to autism. Newborn jaundice can be categorized into 2 main groups, physiologic and pathologic. Physiologic jaundice may resolve on its own without treatment. In term infants, jaundice may appear after the first 24 hours and disappear after the 7th day. In preterm jaundice, it may appear in the first 48 hours and disappear after the 9th or 10th day. Pathologic jaundice, on the other hand, is considered benign. If increased levels of unconjugated bilirubin is left untreated, neurotoxicity takes place and enters the brain cells. Coagulation may be a problem associated with jaundice because of the lack of internal bacteria needed to make vitamin K. Breastfeeding may also be associated with the early stages of jaundice. If an infant that has jaundice is not being breastfed effectively, it may lead to a less caloric and fluid intake, which will lead to dehydration. That is it for the implications. Now to Symone for the protocol.
This is Symone Neymour reporting on the protocols of jaundice in newborns and mothers. It is important for healthcare providers to identify those newborns that are at risk for jaundice, more specifically because jaundice is a common cause of hospital readmission during a newborn's first week of life. Protocols include: mothers are encouraged to breastfeed their newborn at least 8 times per day during the first few days of life. This is to decrease the incidence of the newborn developing hyperbilirubinemia. Also, bilirubin levels should be measured in every jaundice newborn after the initiation of phototherapy. According to the National Library of Medicine, jaundice neonates should remain under phototherapy with continuous temperature monitoring and eye shielding until the serum bilirubin levels are resolved and reviewed by the physician. Furthermore, all pregnant mothers should be tested for ABO and RH blood testing, as well as they should undergo screening for unusual isoimmune antibodies, because these factors can contribute to whether or not a newborn develops jaundice. Phototherapy is an important treatment method that is used especially when TSB levels, which is the total serum bilirubin levels, which measures the amount of bilirubin in the blood, exceeds that. Finally, the G6PD level, which is an enzyme that is found in the blood, should be measured in every jaundice newborn who is receiving phototherapy and also whose family history or ethnic origin suggests that there may be a likelihood of the newborn developing this deficiency. Thank you. Now on to Talia with the management of jaundice.
Thanks, Symone. My name is Talia Brown, and I will be speaking on the management of jaundice. The core principles of management consist of prevention, identification, and assessment of babies who are at risk of developing hyperbilirubinemia. As stated before, hyperbilirubinemia is a condition in which there is too much bilirubin in the blood. Jaundice that results from a small increase of unconjugated bilirubin after birth is normal and generally does not require treatment. The management of jaundice also includes reassuring the parents and monitoring the baby. Treatment that is used to lower the level of bilirubin in the blood of jaundiced babies may include phototherapy, intravenous immunoglobulin, or exchange transfusion. Phototherapy involves the infant being placed under a special lamp which emits light in the blue-green spectrum. The process of intravenous immunoglobulin is the transfusion of an immunoglobulin, which is a blood protein that can reduce the level of antibodies. In pregnant women, treatment includes reducing symptoms in the mother, providing adequate obstetric care, and preventing fetal distress or even fetal death. Ensuring that the mother gets sufficient rest, is placed on a low-fat diet, and is prescribed parenteral supplementation of vitamin K. In final analysis, there is no cure for jaundice, but it is managed by managing the symptoms and the causes of the disorder. Thank you. Back to you, Shawneka.
Thank you, Talia. Okay, guys, now that we've fully explored the world of jaundice, we know which implications to watch for in both pregnant mothers and in infants. We know the correct protocol as well as the correct treatment therapy for dealing with patients with jaundice. Tune in next time. My name is Shawneka Brown, and this has been the Bahamas Health News Update, Maternal and Child Health Edition.